responsibility as moderator of this session to keep us to time, and that means we need to start on time.
We lost 5 minutes already.
I'm going to start calling out names of people who are still talking. Pia, may I invite you to your chair, please? Okay. Good morning. I hope you had a nice coffee break. My name is Tamar Atinc, and I'm at the Brookings Institution. So we're going to continue our conversation about financing in this session as well, and we're going to build on many of the ideas that were developed in the previous session. I thought one of the implicit points in the previous session was around the lack of financing, of the lack of inadequate financing for early childhood development services. Now, I would certainly subscribe to that, primarily because when we look at children's development outcomes, as we often do, we see huge, tremendous needs. But it's interesting because to make that statement, you would think we would want to look at information about how much countries are actually spending, how much services should cost, do cost, and what would it actually take to be able to provide services to all children. None of that information is easily available, as I found out when I started looking at this. So very interestingly, and this isn't true in many domains, I think we're further ahead in terms of looking at having information on children's development outcomes, as poor as that source of information is, than we are about having information on financing and costs in this area. So I think one of the important contributions that the forum can make today and tomorrow is really to highlight this and begin to build the information base for making important policy decisions. I feel that we need information about financing, about expenditures, about costs for three important reasons. The first one is about transparency about societal preferences. This was touched upon in the earlier session, in particular by the former secretary. If there is to be informed debate around public spending in particular, about society's preferences, we need to know how much is being spent on children versus other groups in society, for example, the elderly. Unfortunately, we often don't have information about public spending available in that format to encourage informed discussion about whether or not society's preferences are indeed reflected in its budget. Second is the question, or responding to the question about what will it take to expand ECD services. Most countries will need an expansion in those services, and all countries need an upgrading in the quality of those services. So what will it cost to expand services to all children? And what will it cost to upgrade their quality to a minimum standard? So this requires knowing in a more granular fashion what types of services are needed and what those particular services cost for different segments of the population. Third, and I think this is a derivative of the second, and we had some discussion about this in the first session as well, in many countries funding for early childhood services is in the context of federal systems, where there are intergovernmental systems that provide resources to lower levels of government. So in terms of establishing per capita funding, for example, that takes into account geographic differences, takes into account differences in the composition of the population, as well as encourages quality. There's a need for information about specific costs. So our three speakers today, I think, will touch upon these three objectives that I've briefly discussed in much greater depth. So I'm very pleased to have with us Enakshi Ganguly Thukral, who is the co-founder of the Center for Child Rights. She's going to start us off with a big picture look at expenditure policies in India. Next, we will move on to Anit Mukherjee of the National Institute of Public Finance and Policy. I don't know if that's currently the case or formerly. Okay, formerly so. And he is now at the Center for Global Development in Washington, D.C. So I'm very pleased to have him as almost a neighbor to me at Brookings. And third, we're going to move on to Mariavittoria Bellotta, who is an ECD specialist in UNICEF in charge of an interesting regional program that they have there, looking at, in West and Central Africa, looking at cost and quality of ECD services. So with that, let me turn to Enakshi, and 7 minutes, please. Yes.
I thank the forum for inviting me to this conference, particularly because, as you can see from the panel, we have specialists on early childhood care and development, and we have specialists on finance, and I'm neither. The only reason that I do budget analysis is because, as Mr. Bose said in the morning, Mr. Sumit Bose, because I believe that budget is a very important tool for holding state accountable, for monitoring state performance, and to ensure transparency and accountability of governments. That's the only reason I do budgets, and my understanding, therefore, of budgets is also very minimalistic. It's only to that extent that I can hold the state accountable. If we were to, the context of budgeting for children and financing their rights if it's to be on the principle of equity, it has to be based on three critical principles, and against which we must ensure whether we are looking at our finances. One is non-discrimination, the other is indivisibility of rights, and then lastly, the best interest principle. So are we in any way violating any of these principles when we are financing is the bottom line. And I'm going to use the example of India to raise a few questions around financing for the young child. So here is the numbers and the context that we're looking at. And most importantly, as someone pointed out this morning, these are all the children who we're talking about. We're talking about 158 million children. We're talking about children, and the context was laid out very clearly in the morning by Vinita, so I'm not going to repeat, but we're talking about malnourished children, we're talking about unprotected children, we're talking about children who are sexually abused and vulnerable to violence. And in that context, what do we have in terms of a policy? If India is an example, then we find that the right to education does not include the early childhood care part of it. Despite going to court, what we have is a right to education that's only for 6 to 14, which means that the 0 to 6 is left to the Constitution as a directive principle. All our labor laws have provisions for creche facilities. Are they being financed? We have national plans of action, we have a national policy, we have, interestingly, a separate early childhood care, an ECCE policy which was recently adopted in 2013. We also have an education curriculum framework. And of course, all other provisions for children would apply to children. Here, I am going to leave you with a question. There is a demand from people who work on early childhood care in India that there should be a separate law. Now, what does a separate law mean in terms of finances? Because every law must have a financial memorandum to it. But what does it mean to have a law? Should we have special laws for every category of children? Or should we be able to finance and budget for all categories of children by mainstreaming their rights? That's the question I shall leave for you. We have international standards for finance resourcing ECCE. We have a general comment to the CRC, which is which lays down very clearly that resource allocation is required under Article 4 of the UN Convention on the Rights of the Child, and our national policy on ECC also talks about financing and resourcing. But then, as someone raised a question, I think the gentleman from UNICEF Chhattisgarh said, whose concern is finally the young child? They are spread across different ministries, they're separate departments if they're in the states, and that is probably true because a child's needs is diverse. It would be true of any country. Then who then takes the main onus of financing and budgeting for the young child? I would also ask another question. Are we talking about ECCD, which means a little larger than an ECCE? So then what happens to finances? Except for one scheme, all other schemes in India, for example, fall under the Ministry of Women and Child, who have no experience on education. Now, just to give you you're not supposed to read this. This is just to give you an example of the number of schemes and number of programs that actually impact the young child in India. And they fall under all of these categories, which is Ministry of Health, Human Resource Development, then the child care services would go under both the Ministry of Women and Child and under the labor ministries, and there's nutrition, and then of course there's social protection, which we seldom talk about. We hardly ever talk about protection rights of the young child, and therefore what kind of budgeting would be required to protect them from abuse. In a sort of ballpark figure, when we tried to do, my colleague is sitting here, she helped me to do a sort of a ballpark figure for the average spending on the young child, looking at all those ministries that in those small that we looked at here, and all we got from all of these departments and all of these ministries was only a 1.16% of the union budget. Now, as Mr. Bose also pointed out, the overall resourcing for children is going down in the country. And we do know that while many children are left out, if you're going to go by the non-discrimination principle, there is an urban-rural divide. In fact, the ICDS, which is our main program and has been referred to several times, it's the rural child who uses it much more than the urban child. The urban child, it's abysmal how, it's bad enough how it's implemented in the rural areas, but if you look at the urban child care center under the ICDS, there's nothing there. It's a feeding center. Then, of course, there are the children who are marginalized, like the Dalits or the tribals, who are further left out, and the disabled child hardly ever finds a space. So these are all those children who are left out of this 1.16 budget that we already have. There is, as was pointed out again in the morning, a very high dependence on the private sector, and we don't know how much of it is coming in from the private sector, but we do know that the minute anyone can afford anything better, they move to the private sector. But there is no, we do not have an estimate of the numbers that it caters to, nor the resources that are spent by families on the private sector. So, my question therefore then comes to where should the resources come from? And I think that's an important question that we need to ask, and I'm going to leave you with these questions, because if you're going to go by the human rights principle, then to my mind, state is the principal duty bearer. And therefore, we should not, the involvement of the private sector or the civil society must not mean abdication of state responsibility. And how do we ensure, therefore, lack of leakage, corruption, and ensure greater transparency? And how do we ensure that the 2% cess of the CSR that comes in, where should it go? Should it be augmenting the government services, or should it be allowed to run parallel services? So I'm going to leave you with just these three questions. One is, how do we track budgets? Two, how do we not just invest the money, but also ensure utilization and spending? Because the track record is that there is much more, what is invested is not spent, and we ensure it is based on universality and non-discrimination. What should the role of civil society and the private sector be? How do we ensure that the state does not, we do not, in our effort to augment services, lead to abdication of state responsibility? And how do we ensure that we value ECCD? And I'm going to leave you with this one information, that our Anganwadi workers and our creche workers are not even paid minimum wages. And therefore, that is the value that we give to the young child. Thank you very much.
Thank you, Enakshi. I'm going to invite Anit to the podium.
Good afternoon. I think we've turned the clock after 12 o'clock. So thank you very much for having me here. And I'll start off with the same existential question as Mr. Bose and Enakshi said, like, why am I here? I'm an economist. I've worked for the past decade or so in the field of elementary education and to some extent in health and HIV. So when I was invited to present in this August forum, I have a few butterflies in my stomach. And since this is my first ever foray into the field of early childhood development, I decided to go to the field in order to understand what's going on. And this forum is about costing, so not going to the field and doing costing means reading a lot of very boring government documents. So, which is what took me to Rajasthan about a month ago. And Mr. Bose mentioned a survey that is done every year in selected districts of India which track expenditure on education, especially elementary education. And we try to find out whether schools which are supposed to receive some money has actually received it or not. And interestingly, one of the schools in our survey is this one. As you can see, it's about 4 acres of land, pretty barren, and at the end of the line you have a school which has 2 classrooms. So we went and we were trying to disseminate the results of the survey to a group of parents, and it was a pretty nice classroom, and we said, the teacher said, well, the money didn't come for the teaching learning material. And I said, well, still you've done pretty well. The walls are whitewashed, and like you have got some material over there. And then the headmaster very sheepishly said, actually, this is the early childhood center. And the actual classroom is the next one, which, because the enrollment in that school has fallen below 30, they can use only one classroom, and the other classroom has been given to the early childhood development center, which we call Anganwadi. A little bit further to another village, we came across this old, pretty dilapidated building, which also serves as an early childhood center. So here, the courtyard is not that big. There are certain stimulation items and all that. But finally, what it boils down to is that both these centers are actually feeding centers. So food is the main source of activity. Now, if you look at it from, if you look at it from, I'm sorry, is something going wrong? Okay. So if you look at it from a cycle, investment cycle, what we have here are infrastructure, human resources. The lady in the pink is an Anganwadi worker. Then there's some activity going on, some services being delivered. But finally, what we want to get at is the top right-hand corner, which is a school. So all these children should be well fed, should have early childhood education, and go to the school. Somewhere things are going a bit wrong. And if you look at the life cycle investment, I think Mr. Bose mentioned the life cycle hypothesis, that if we look at what are the stages of the life cycle and we look at where the early childhood fits in, it's actually the first 6 years, but the impact continues towards the rest of the life. And here, I think one of the important critical questions we have to answer is how are nutrition, health, ECE, education, and social protection. All of these come together in a whole big framework. And not unsurprisingly, investment in young children overlaps across generations, multiple beneficiaries, mothers, children, children with severe malnutrition, delivery modes, outputs, etc., and the challenges of mapping objectives to costs, cost to resources, and resources to outcome. These are not easy challenges. And economically, when we look at any joint product, any service that delivers a joint product, costing becomes very, very difficult. So we are at a moment in history in India where the ICDS, our big ECE scheme, is also undergoing a lot of reform. And if we look at the 4 big key components, they are supplementary nutrition, preschool, care and nutrition counseling, and health services. And if you look at the top, just the top bar, if you look at unit costs and what unit costs are actually prescribed, it's mothers at about $35 per mother per year. Normal child is 30, and child which is severely malnourished is about 45. That's dollars per year. Per child malnourished is 45. So we have a sense of what the government or the official unit costs are. But, and there are also certain fixed costs of creating infrastructure and also payment to services. So what has been happening in the budget? Where is the money coming from? The money comes from the allocation made to the Ministry of Women and Child Development. And as you can see, it's about $3 billion. If you have 6,000 crores, it's about 1 billion. So do the maths, we come to about $3 billion a year, which is allocated for early childhood development by the federal government. State governments mostly spend zero on this, which is something we can discuss later. But what is more surprising is, well, not all the money is released. So in fact, it has hovered around half, and now it's increased to about 70%. Why is that? One key factor takeaway from our studies are that there are complex implementation guidelines and financial management processes. And these are people who are already overburdened, who have to fill up 11 registers and also a financial register. Now, what's been the outcome? And I don't have too much of time. If we look at just the data coming from the government, the ICDS Center for Supplementary Nutrition, this is only supplementary nutrition. In Bihar, it's about 168 or 194. I mean, it's too small to read, but yeah, it's 194. Overall, all over India, it's 68 per Anganwadi center, per ECD center. This is just feeding children. And if you look at the top 4 states, which are all in North India, where malnutrition rates are high, you can see that obviously there is a huge demand for ECD services, at least under nutrition. And what has happened over the last 2 years is also that there has been a big push, and that big push has led to, this is official data caveat, significant reduction in malnutrition rates or children accessing centers who are malnourished. But obviously these have not been done by independent studies. So big takeaway, huge demand for feeding, very little emphasis on early learning. In fact, we cannot cost the early learning part and definitely not the outcome. And by the way, all this data has been compiled by Accountability Initiative, and they spend hours and hours just tracking down where that one piece of information can come from. So data is not available at transparency issues. And finally, we cannot do an outcome analysis in terms of what is the bang for the buck that we are getting, even in the nutrition space. So I'll leave those questions, and we can come back during the discussion. Thank you.
Good afternoon, everybody. And thanks to my colleagues in the panel for such a great introduction to the costing issue. I am glad to present you an experience that UNICEF Western Central Africa Regional Office is piloting in 10 countries in the Western Central Africa region, which covers 24 countries. Just before I start, you are aware probably of the conditions of the majority of the countries in this region. Countries are affected by conflict, like Mali, Central African Republic, epidemics, the Ebola outbreak is everywhere in the news, malnutrition. Young children are living in these conditions in the majority of the countries, and when we advocate for early childhood development and finance for early childhood development, we need to take into account that conflicting priorities on the government agenda for health, for nutrition, for infrastructures. And our attempt with this program was to, as Caroline said before, to create local evidence to have a stronger message for our national counterparts. Global evidence on ECD is great nowadays, where it's not enough for countries that have so many priorities to deal with. So we need to engage the national counterparts and the partners and the civil society in creating this evidence. I have so many indicators that I could share with you, or evidence on the conditions of children once more, but the one that I chose is the one on school readiness in Western Central Africa region. Preschool education is still an option. I don't know if you can see the figures, but the average is 24.5% of children having access to preschool education. Out of these 24.5, I would say that 80 to 90% live in urban areas and comes from very wealthy families, I would say. So inequities is again one of the major characteristics of the countries in the region. 24.5 is not representative at all of the majority of these countries. You will see countries like Chad or Mali that have only 2 or 3% access to preschool. So this is the conditions in terms of preschool education, but one of the major issues is, of course, malnutrition as well in majority of these countries, and we know the links of malnutrition with child development. So just keep this in mind to understand the context we are trying to work in. So preschool education is still an option, which means that young children most of the times are not on the top of the agenda. The program aims at rolling out 3 types of tools in 10 countries for measuring parental behavior, early learning outcomes, and feeding then costing model in those countries. I would say that there is a good dynamics going on in majority of these countries where the national counterparts comes to organizations like UNICEF or other partners, the World Bank, for example, the GP, and ask for support in costing, ask for support in making early childhood services a reality. But if they have in mind the targets, they don't know how much it costs, and they don't know how they can include the issues related to quality, for example, or customize the service to the conditions of the country. So the parental behavior survey is the first of the tools, aims at measuring and assessing the quality of the interactions caregiver and children, looking at, for example, the availability of time for mothers and caregivers to spend with their children and to interact with the children. This is something we are not used to cost. This is something we are not used to look at. But if the mothers have no time to spend with their children, there is no interaction going on. The parental behavior survey also look at social and cultural norms. Some of the mothers, for example, interviewed in Mauritania through these surveys, admitted that they didn't talk to their children as long as their children were toddlers or up to 3 years old, because children couldn't talk to them. So there was no point in discussing or talking to the children. Now we know that in some of these countries, majority of these countries, there are a lot of potential beneficial practices in terms of stimulation and, of course, interaction. But some of these points that comes out from the parental behavior survey can help shaping parental education programs better and then define the costs for these design. The second tool is the early learning assessment, which is the tool I'm most passionate about, because it's really helping us in some of these countries coming up with the information about the actual impact of outputs and supply and demand on child outcomes. This assessment is done on children entering primary school the first 2 weeks and is building a sample with children that have been to preschool or not have been to preschool. The first information, of course, is no news, is that those that have been to preschool are far more prepared to enter primary, but this is big news for the countries that are doing this, because again it's contextualized. I want to bring you directly to this, which is one of the most important findings that we got through the early learning assessment, which is the fact that the research, the tools is showing us that 2 years of preschool actually give us 90% of the outcomes required to start primary. 1 year almost give us 60%. This is the case of Togo, where we did the assessment. This kind of information, contextualized to the countries where we are working has huge implication for costing, and can make sure that at least 1 year or 2 years of preschool are included in the national budget, with a lot of evidence on the school readiness and preparation of children to school. Other information that are coming up from the early learning assessment and that really fits the costing model is the fact that some of these countries don't need high-level university teachers for preschool, but can have very good can contribute to very good children outcomes with very specific and short-term trainings for community teachers, for example, enabling these teachers to deal with the actual organization of the day with toddlers. Other information that are coming up concern the size of the classrooms, the infrastructures. We are trying to cross all these indicators, all these elements with the actual outcomes of children once they enter primary. And this, again, has huge implications for the costing and the budget. Quickly, what we are trying to do is, of course, the costing model itself is not a new costing model. If you are comfortable with the education sort of costing model, this is what we do with the countries. What's new here is that we try to feed the costing model with this new evidence and the process of creating this evidence, which is very much participatory and done at the national level with the Institutes of Statistics, with the preschool education sector and other civil society. As I said, these are just some of the points that comes out from the tools and that we are trying to measure and cost. And I want to finish with a positive perspective, which is that there is a great opportunity for community-based options in countries in West and Central Africa. So far, we knew that they were less expensive. We didn't know that their quality. And what's coming up from the early learning assessment is that the potential for school readiness is very, very high in community-based options. So indeed, there is to solve out the problem of decentralization and governance, as Pia mentioned before, but we have evidence that this can be one of the solutions to respond to the lack of access and offer of preschool, for example. So much to say more on parental education. I can say it more, but I will answer your questions with pleasure. Thank you for your attention.
Thank you very much to the three speakers for providing very interesting information that I hope will spur good discussion and for keeping to time. I think they were very successful at both providing us a framework for looking at issues, but also on-the-ground experience with programs. So we have a complex topic. We have services that are provided by multiple agencies, multiple levels of government. That's for the public sector. And we also heard the significant, in particular, parental involvement, whether it's financial or in kind in terms of their time, and also the engagement of the private sector. So putting all this information together to come up at how much countries actually spend on children's services is not an easy proposition, and where countries do it, it needs to be done manual. There are no systems that are geared towards systematically providing this information and putting it into the public domain for discussion. We also heard that there's a difference between budgeting and spending, and that costs are likely to vary by geography. by quality, by the composition of the population. We didn't quite get into that, but I know you're familiar with the cost of reaching hard-to-reach or disabled populations are likely to be very different from the cost of reaching the average child, if you will. And the very important question about bang for the buck. What do you get for the money that you spend? In the social sectors, the relationship between funding and outcomes is not a very robust one usually. A lot of things that intervene in the process. But very interesting to hear the specific work that is being done on the ground to really say what is enough. Is 2 years enough, or do we need 3 years of preschool education? What qualifications do teachers need to have? These are the kinds of questions that need to be asked in the specific context to be able to respond to really the requests of policymakers to make informed decisions. With those words, I want to open it up for your comments, questions. I do have a great deal of respect for hierarchy, so I will take some questions from forum members, but I do also have a penchant for hearing from others as well and getting a diversity of views, so I'd like to hear from others also. Yes, please. And please do introduce yourself briefly.
My name is Amarjeet Sinha. I'm a civil servant who's worked in the human development sectors, education, health and nutrition at the national and state level in India. In fact, it's also a bit of an overlap with the previous session and the points that Enakshi made. There are a few policy issues. There are also a few institutional issues which I find recurring in every presentation. When Anit was sharing the PowerPoint slide on how the child is compartmentalized into so many departments. Social protection is important, early childhood development is important, nutrition is important, schooling, health. How, again, Enakshi's slide, which she didn't want us to see, and the kinds of services required to ensure. I think I relate it also to what Sumit Bose was trying to say in the morning. I mean, clearly, the point that Enakshi has made in the Indian context of the 0 to 6, and in many ways the neglect of the 0 to 6, because of policy choices that we've made. Preschool is not a part of the school system. It is a part of another department. Now, this is a fundamental issue which has been repeatedly raised. There have been proponents who are very strong, no, 0 to 6 should not be broken into two parts. The issue is not about breaking it. The issue is, where do you locate preschool learning? Because clearly this is throwing up challenges and problems. That's an issue I'd like to frame. The other is, I think when Sustainable Development Goals was being talked about by Jan in the last session and also in this session, I think it's time that we looked at human development differently. The problem is that we are compartmentalizing it so much that at the cutting edge level, the person for whom we wish to work does not know 9 entities. For ECD, we want a separate committee. For literacy, we want a separate committee. For nutrition, we want a separate committee. For education, a separate committee. It's time we went on to a common institutional platform of human development. Because again, if you want to monitor outcomes, outcomes in education are linked to nutrition. Outcomes in health are linked to nutrition. Nutrition outcomes are linked to education. So I think all these issues, I raised the issue and I asked the panelists on common institutional platform of human development as the engagement platform with communities for a whole lot of investments, because it has potential for improving efficiency, effectiveness and outcomes. And the second issue, which is a policy choice, the 0 to 3 needs a very different focus. What is the view, I'd like to know from Enakshi, on the 0 to 6 coming in the way of more effective policies for the 0 to 3?
Thank you. Let's get a couple more questions if we can, and if you can be brief in your remarks, then we'll get more. Anybody in the front? Yes, please. I'll come back.
Hello, I'm Ashrafi Ahmed from Director General of Health, Bangladesh. Well, I was interested in Ms. Bellotta's presentation. How do you allocate the money related to the quality indicators? Since you are the donor agency, does the governments you work with, do they have a say in determining the quality indicators, and how do you really measure the quality indicators? Thank you.
Yes, in the back, please. Further back, yeah.
Good morning. I'm Shumon from IFPRI, New Delhi. We've recently been working on some costing papers for the ICDS and NRHM, and while doing this sort of analysis, I came across the biggest problem was that the costs that were on the websites of these government departments weren't standardized. They hardly were even reported, they were only reported state-wise, and the different kind of expenditures made on ICDS General versus SNP were not very clear. Again, they weren't even clear on what expenditure they made on each of these age groups that they target. So would there be a need for even the NRHM and the ICDS to be reporting expenditures in a standard format so that this analysis of how much you spend on each beneficiary can come out in a much clearer manner?
Okay, why don't we take those three questions. We'll start with Enakshi and just go down the line. I think the first question I would appreciate hearing from all three panelists in terms of this proposal. Is it time to have a common institutional platform for thinking about human development broadly? And then there's a question about the standardized costs for ICDS, and a question to you, Mariavittoria, specifically on the UNICEF program.
This is a question that's always boggled me, Amarjeet. But I think the constitutional framers, when they have introduced Article 15 and said they have to have special provisions for women and children, was because they recognized that if we had a common flat platform, there would be groups of people who would be left out. So how do we, my question therefore remains, how do we include with affirmative action and yet mainstream? You know, that's where we, and to my mind, yes, I would think finally it is decentralization where it all converges. And just to give you an example, HUC is implementing a project completely on a different thing on child marriage and on prevention of child marriage, and we are experimenting with just that, is to strengthen the local self-government systems and to hold them and to empower the communities to hold the local self-government systems at the district level and the block level and down to the, and we find that that's where the convergence is. The local tehsildar or the block official doesn't say this is this hat I'm wearing and this hat. It's at the state level that, so somewhere I think that's where the common human development platform, to my mind, can be located, and it's a thought that I would leave to you. And yes, in the child rights framework, we always talk about age-specific investments and age-specific interventions. And when we break groups into 0 to 6, 6 to 14, we somewhere miss out on the specificities of certain age groups. 0 to 3 definitely requires a different kind of intervention than the 0 to 6, from the 3 to 6, who require specifics. But because they've all, as a category, got left out of the right to education and thrown into the WCD ministry, we are facing this kind of a problem at the moment, where WCD is also looking after the educational needs of the entire 0 to 6, along with the 3, and they all club together in the same center with very poor infrastructure. Here is also the whole thing of implementation somehow, of how people are trained and what do they see. I think those are also issues that we need to look at. Thank you.
I can speak for the reality of the region where I work, where it would be great actually to have a common platform for human development, but at the national level the institutional structure makes it still difficult to, you know, it's like if you're moving at different speed. So to come back to the questions of Caroline this morning of what we do now where there is no financing, I think the opportunities in the existing sectors in their being sectors, having a sector budget for making sure that young children are taken into account in the agenda of today, looking at tomorrow as an opportunity to have this common platform. Still, some experiences have been going on in countries. There were many attempts, actually, for example, for early childhood development, to have a national platform for early childhood development, grouping different ministries and social society members. It becomes then an issue of accountability and decision-making in most of our countries when we try to build these bodies that put together different sectors. So there are some limits in a common approach, and of course a lot of benefits. The reality of today in some of the countries that we still need to look at priorities in different sectors agenda and sneak in the young children rights. Thanks. Sorry, I thought I had to complete. Sorry, I completed the other questions. Well, thank you. For the questions related to the UNICEF program, thank you. I didn't get into the details of the process, but I will be happy to discuss later more. The reality is that the tool that is used to assess child outcomes is designed at the national level with the Ministry of Education and the Institute of Statistics. The questions that are in the tool are really localized and are different. The early learning assessment that we are finalizing in Niger is different from the one that we did in Togo. You have different questions included on the basis of the inputs from the preschool direction and civil society. So it is not designed at the top from UNICEF or other organization. It is really built at the national level through different meetings and forums with the Ministry of Education and other stakeholders. Thank you.
I can trust Dr. Sinha to absolutely have the most difficult spin like question that can be thrown at the panel. I think one of the things that when I looked at the program, it was this is a forum on investing in young children globally. So obviously the common platform approach is something that we haven't just to get out of that sector, and therefore in my mind I think the common platform emerges from whom do we invest in, and there it's a child-centric approach. I mean, it's the child. I mean, and all the divisions that we do are basically administrative divisions. If we look at ASAR, the annual status of education report, more than 50–60% of children are in school before they are 6 years of age. They are in school at 4, they are in school at 5, they are in school latest by 6. So it is actually something which is it's a cost to the system, and there are inefficiencies that are built in as soon as we get away from the common platform of having a child who is school, and we do all these school readiness assessments and everything. From the public finance approach, I think there is huge scope for convergence of programs and monies. I mean, the classic case that all of us who have been in the field have seen, that there are two gruels, khichdi we call it in India, dal with rice, and one comes from the ICDS self-help group and one comes from the education self-help group. Self-help group is the same. They're just making the two different khichdi's because they're getting two sources of money. So in a sense, there is so much of efficiencies that can be had from a common platform. And you know better than anybody, sir, that what is the challenge of implementation of two different schemes in one particular service delivery point. There was a question about costs.
Yes.
I think that's a very pertinent question, and that relates to this common delivery platform. As soon as you try to apportion the costs into different silos, you are going to run against this wall of what is exact cost and how do you measure it, because these are joint products. So in a sense, until you can disentangle those costs, and the only way you can do that is either through a very, very randomized sample which you go only to focus on particular aspects of nutrition, for example, or you use the government data, which apportions the costs accordingly. But it's very difficult at the service delivery point to differentiate the two costs, and we can discuss more about it offline.
Let's take another round of questions. I was hoping to have some questions from outside the room. So for those of you who are watching, if you do have any questions, please do submit them. We have people that are monitoring the web. Let's turn back to the room then. Yes, please. Could we have a microphone?
Yeah, we're talking about convergence and how to have a common institutional platform. I just wanted to very briefly share the experience of the project that Mr. Sumit Bose mentioned in the morning, the project Bachpan, which was done by the World Bank with Nandi Foundation when I was there. In that project, what we did was the funds were flowing from the central government to the decentralized entities under these silos of health, nutrition, education. And the main initiative in that project was to utilize them in a convergent manner at the village level. So it was the entire funding was done through village plans for children rather than village plan for health, education and nutrition for children. They were village plans for children which were developed by resource groups that were composed of village, the community, of the service providers, as well as other functionaries at the panchayat and so on at the village level. These plans were coming up to the district level, and the fund flow was coming in the three silos from the government of India or from the state government, and they were converging at the district level. So at the district level then, they were utilized in response to the plans that were coming from the decentralized entities. And it was a project that was evaluated very rigorously and found to have very good results. Of course, as he said it was a resource intensive. And just one other point I want to make about the fact that you mentioned about the community preferences or social preferences, how the funding should respond to that. I just want to raise an issue that there's often the society preferences go in one direction and the policies go in another direction, and the two don't meet. So I think somewhere that is very important also, because if we are thinking in terms of generating funds from the public, from the community, as well as doing it in a partnership modes, somewhere there has to be this sync between what the community wants and what the government is willing to spend on.
Okay, I have two people here, Jan as well as the gentleman there.
Hi, my name is Sushant, and we run a company called Parvarish, which trains parents and teachers on bringing up children. So my question actually was a comment. We've seen this very often, that all those schools, the state-funded schools, are more of feeding centers, which we saw at Red South. Now, you may accuse me of oversimplifying it, but it's very simple. Like, the one you focus on is the result. Like, what you focused on and put money into was how can we bring in children, and the route we thought was to feed them. Now, if we took feeding as a route to get children in the school, that's exactly what we got. Versus looking at capacity building of the teachers or these structures so that children come there to learn. Now, I think it's high time we stop focusing on feeding them to bring into the school system versus giving them the value they need to bring into the school system. So that whole money has been spent doing X, expecting Y to happen. So it's like a question: do we now move to the real Y to get the Y out?
Could you please pass the microphone on to Jan? Thank you.
Thank you so much. I'd like to talk about compartmentalization, because a number of people did. And we don't like that, because children need to develop holistically, right? However, ICDS and a number of other programs around the world seem to illustrate that if you do not compartmentalize, if you integrate various services in one program, it's difficult to track spending, it becomes intransparent, and it may even be the cause of the significant underspending. You just don't get the money spent. If that is true, why can't we argue as follows? What really counts is that services come together in the child. Right? Now suppose the Ministry of Health in India would say, we're going to run a program for nutrition and we're going to roll it out no matter what. If we come to a village where we see that there's an Anganwadi and it's functioning well, we'll use the Anganwadi as the outlet. Right? It's all under one roof. This is probably the best. When we go to the next village and there's no Anganwadi, we find another place. It could be a community center, it could be the home of one of the village elders, whomever we can trust. You may even avoid the Anganwadi where they are, because in those villages where there's an Anganwadi, you may not reach all the children. Enrollment in the Anganwadi could be a criterion for exclusion from the nutrition. Right? At the end of the day, you will have attained that those children will have access to the nutrition. And you can have the same argumentation for other services. So I would almost, and this sounds very strange, promote compartmentalization, because it might be the best way to make sure that children have access to multiple services which will support their holistic development. Make sure it comes together in the child, and don't join it at the national or mid-levels or district levels, because the only thing that counts is that it comes together in the child.
Chris.
First of all, just to thank whoever put the program together for putting the costing early on. I always find that the costing gets stuck on at the end as a sort of little bit of an extra that someone must go off and do as a technical exercise, and so it's very nice to see it early on. And it's related to that I wanted to ask the panel for some reflections. I wanted to differentiate between two types of costing. So there's costing what is, so how much are things currently being spent, and there's costing what should be. So what are you planning to do, and how much will that cost? And maybe to just reflect on your experience in the latter. So we've heard a little bit about the costing what is, but a bit more about how one brings in the program people to discuss what should be. I think I might be looking for some group therapy here, because having done this myself, I find that the program people tell you, this is what we want, which is always entirely non-specific. They don't want to make any of the difficult decisions, and they want to leave it to accountants and economists. I'm not quite sure of the logic around there, that we must decide how many home visits people get, or how well staffed the center is, or how, the detail is never specified. And so maybe just to bring it to a very concrete example, is that, for example, we keep talking about equity. We're saying we want equity, we want equity, well, equity of what? So if you want to say equity of access, the costs associated with making sure that everyone has equal access to a service are one amount. If you want to say you have equity of outcome, then you'll have to divert resources very heavily towards those in the most difficult circumstances, and you'll have an entirely different cost structure. And so this is not something that we can leave as a technical exercise. I'm just wanting your reflection on how to bring in the program people, the policy people, the decision makers, those who are involved in making these value judgments and setting the detail into the process, so that costing isn't seen as a sort of technical add-on exercise. Thanks.
Great, thank you. Could I have a show of hands as to how many others have questions? Okay, so we'll try and see if we can do another round if we're efficient in taking these questions. So let me start at the other end. A lot of questions on institutional structures of delivery, and then an implicit assumption that financing will have to follow that. I just want to throw out also that there is the alternative, which I guess we'll get into in the next session, of providing financing to the demand side and making decisions based on what households themselves would value, rather than putting funds into the delivery mechanisms. Go ahead.
Yeah, thank you for a fantastic set of questions. I think the feeding learning, the dichotomy, obviously there are two costs associated with, one with the feeding, one with the learning. If we look at what our school feeding program, the big midday meal program, has achieved or has not achieved, I think it has achieved in the beginning, initially a huge jump in the enrollments coming, and especially in the poorer areas. It still does, but there is a shift after 4, 5, 6 years in the mindset of people or parents to start sending their children to places where they can learn, not where they can feed. right? So in a sense, it is also a question of time. And within that time, there are places which have done exceedingly well when the children came into because of midday meals, to also increase their investments in teachers and infrastructure and get a sustainable long-term return on that investment. So just by saying that let's not focus on this one and let's focus on that one and just push the costs or the resources around, I think that's missing the wood for the trees a little bit. We can discuss that later. And quickly, Chris, I think in HIV we've discussed this ad nauseum on costing what is and costing what should be. Costing what should be is always more difficult, so we do not cost what should be. And we would kind of try to look at what is and hope that those would translate into cost. One of the key, I'll just take 1 minute of time. One of the key differences between the old ICDS and the new one, according to me, a public finance person, is that there is task shifting. More community engagement in delivering or monitoring malnutrition. Now, we have discussed that even in HIV when the care centers were kind of, the care people with HIV were being cared for in the households, and how can we cost that? I think the task shifting that is taking place within the program is a very, very understated and unreported implicit cost that is put on the system, and these are the costs that would increase the inefficiencies in the system. I'll leave it at that. Maybe we can come back.
Mariavittoria, on costing in particular.
Yes, thanks. I think that what we are trying to do is really, with this program that I presented, is really to help counterparts in costing what it should be, knowing what it should be. Trying to create the evidence on this. So the early learning assessment, for example, is giving us evidence on what impacts on child outcomes when they get to primary. Is this a matter of the language they deal with when they are in their different forms of preschool? Is it a matter of the teachers' training? Is it the infrastructures? Is the nutrition status of these children? Is the family environment? Is the curricula? So we're trying to go through these details to know what really would make the best out of these programs, and then try to cost. The reality in some of the countries is that when we are approached as international organization, as partners from the Ministry of Education, for example, the Minister of Education himself is very much passionate about ECD, and he says, I want to go from this current 3% to 50% in the next 10 years. And I really want to go there. And this is doing the costing of what it is today, but we don't know the cost effectiveness of the programs that exist today. So this is a preliminary stage we need to support countries in, which is defining the different forms of early childhood services that exist and their actual effectiveness in terms of the outcomes we are all looking at, which are related to, overall early childhood development, and specifically on school readiness, and help these programs being effective as they should be in the future. So to do this, we need to look at all these details. With our experience is that what we are doing is really helping out, defining what it should be and costing what it should be. And being realistic as well, and supporting the view of the counterparts in terms of being ambitious, but also having the costing model including the reality of the financial resources available and the financial resources expected, the feasibility of having some financial participations from the communities and from the families, having it clear that on theory it can be easy, but in reality this financial availability is not always there. So, thanks.
Enakshi.
Very quickly, Vinita, I do agree that community preferences versus policy is a very important issue, and we must take community preferences into when we make our policy. But just to add a caveat that we must ensure that because communities are often very exclusive and discriminatory. So how do we ensure that they are the policies are inclusive? And how do we make sure that it's, that balancing is done? Secondly, we are talking, the real why is very important. Excuse me, I don't know your name, but the real why to your question is very important. But we are talking about 48% children who are malnourished, and I don't think they could be learning if they're hungry. So I think that's the perspective we need to keep in mind when we make the shift from a feeding center to a learning center. And with Jan, the answer I think was Vinita's answer. If we keep the child in the center, I don't really care whether it comes from multiple services or one platform. But can we make sure that the child gets all these services? And that's where the problem is happening, because we are dividing the child into many segments rather than the programs into many segments. And in terms of costing, and I would really like this group to be able to help me do this, what are the standards we are looking at? Because we don't do standard setting, therefore we can't do costing. What are the standards we are looking at? The minimum or the maximum or whatever we call it, but there has to be some kind of universal standards that we set for ourselves, which then determine what services the child must have. Therefore, for that, what is the quality of capacity building of the caregivers that we're looking at, and therefore what kind of training they should be, what is the infrastructure, and then that's when the costing happens. But we don't do it like that. We just go, okay, now 2%, next budget is coming, let's increase it by 3%, and then two children get left out. So the standard setting for me is a very critical exercise.
I'll take one burning question if there is one.
3 burning questions.
I see 2 hands.
3.
Where's the third?
There, at the corner there.
Oh. Are they really burning? You may not get answers. You may get your questions in, but perhaps no answers. All right, let's go. As long as you're willing to sacrifice your lunch.
Thank you very much. Mine is really, really bad. I'm Florence Baingana from Makerere University School of Public Health. I'm a psychiatrist and public mental health specialist. And I'm really excited to be here and to hear all these excellent papers. But I think my issue is this idea of investing in children as a trajectory to positive outcomes, I think somehow is missing one piece on what exactly to invest in. So I thought this session here would talk what are the different components that we're going to invest in if we are thinking of a package, and maybe define an essential package. And this is where I make the case for investing in mothers' mental health, as well as the health of children in a promotive as a promotive intervention, rather than waiting for them to express some of the disorders that they may express as a result of some of the very many vulnerabilities we had about, such as orphanhood, HIV, violence, malnutrition, poverty. I think it would be wise to invest in children. I also would have wanted to hear a little bit about how to adapt Western models to low-income country situations, especially in community settings.
Next, there was, in the back there's a lady.
Hello, I'm Geeta. I work with CARE and international organization. I pick up where Dr. Mukherjee left, what is cost and what should be. I think we need more detail on that to understand, especially for a country like India, where we're still struggling, what is the cost, what should be the cost and what is cost. My actual question is related to integrated programming. What I really wanted to understand from the panel is integrated planning is a more effective way of addressing ECD. Are there evidences? Or is the sectoral approach is a way to look at? If we say that there is a integrated programming is a way to address ECD or to look at the finance, at what level integration needs to happen from a finance perspective? The related question is, I think that's all. Thank you.
There was a third person, back there, and that'll be it.
Burning.
Yes.
Hello, good afternoon. I'm Bindu Gopinath, Department of Social Justice, Kerala. So I'd like to ask about this. Neuroscience has shown evidence regarding the importance of ECCD and the first 1,000 days of the child's life. And our government also has recognized that, and as part of restructuring of ICDS has invested in a lot of money. But when not, ICDS has got a big role to play in India with regard to this. But when ICDS functionaries are used for non-ICDS work, isn't this an indirect way of diverting funds and a child rights violation? Can the forum take up this issue in a strong way? Unless that is done, how much amount of work we put in, it will never show results. Can the forum comment on that?
Okay, 10 seconds, sorry, by way of response, and pick the questions that you'd like to answer.
I don't think I'm equipped to deal with whether ECD should be done integrated or, okay?
I think we've already talked about that enough.
Yeah, the fact that we are not in, the fact that what you're saying shows that we are not serious. If we were serious, we would not divert. That's where I meant that standard setting becomes so imperative. And also finding out who is getting left out. But even since I have the mic, and I'm going to hold on to it, and just to ask this, I hope that all of us will also debate the role to be played by civil society and private sector and not lead to abdication of state responsibility, because we don't want our children to be fed biscuits again.
Victoria. Okay, very good. Just to say that this is a forum with a large number of events that are to take place over a period of 3 years, so we're not going to get answers to each and every question in this particular forum today. And the question of investing in what already was touched upon in the first one. But it is a critical question. If we want to cost what ECD services cost, we obviously need to know what services we're talking about. Go ahead.
I have nothing more to add than saying that let's do more research. Thank you.
All right. With that, thank you very much, and have a good lunch. Thank you.
Thank you, Tamar.
Tamar, thank you very much.
I hope you got to watch it.
The worst thing about a jet lag is when your hunger starts.
Yeah.
At the wrong time.
Afternoon session, morning.
Exactly. We should be learning and not feeding. So.